Hi, my name is Hillary Robinson. This is my validation video for a sterile wound change. I would start by washing my hands. I do not have a sink in here, but I would perform hand hygiene. I would then go into my patient's room and close the door for privacy. Hi, how are you today? My name is Hillary. I'm going to be your nurse. Can you please state your name and date of birth? All right, and I'm just going to compare that with your hospital bracelet. That's great, it's a match. Can you tell me if you have any allergies to any medications or latex? No? And can you rate your pain on a scale of 0 to 10 for me? It's a 0? Great. So that pain medication we gave you about a half hour ago is working. I have a doctor's order to do a sterile wound change on your abdominal wound dressing. So I'm going to go ahead and just position you. I have to lay you flat. If you get uncomfortable, just let me know. Still doing okay? Great. And next, raise the bed to a comfortable working height. And I'd also put this side rail down. I just have to expose your abdomen for the wound change. And I would then just put on a pair of clean gloves. I'd also put a chuck at the end of the bed for any garbage. So just looking at the outer ABD pad, I'm not noting any purulent drainage, so that's great. I would next carefully remove the outer bandage by holding my patient's skin down and peeling away so I don't rip or my patient's skin underneath. So just carefully taking that off for him. And I see my two 4x4s also have no purulent drainage or malodor. I would then remove the packed gauze from his wound, just being careful not to touch the wound edges or disturb any healing tissue inside. I noted in the chart that there was two pieces of gauze that were packed in the wound, and I have removed both pieces. Looking inside the wound, I see it's nice and red, lots of granulated tissue, which is indicative of healing. There's no slough or eschar noted. I would go ahead and next palpate the outer edges of the wound for any bogginess or warmth. And neither is present. So I'm going to go ahead and measure the wound. I would start with length. And the wound is about 5.5 inches long. And then I would go ahead and measure width at the widest point. The wound is 1 inch wide. To measure depth, I would use a sterile Q-tip. And at the deepest point of the wound, I would just carefully place it inside, being careful not to touch the sides or anything in the wound. And I would just gently slide my fingers down. And my wound is 1 inch deep. I would then remove my gloves and perform hand hygiene. Again, I don't have a sink in here, but I would wash my hands again before setting up my sterile field. This is the only table I have available to me in this room. It is below waist level. I would not use this in real life because this whole thing would be contaminated. Yeah. I would start by carefully opening my sterile wound kit. I would hold it at the base, being careful not to touch the outer lip, and gently peeling the top packaging away from me. I then want to pick up my drape so I can go ahead and set up my field. I'm only grabbing it on the 1 inch border, keeping it above waist level. And I would then go ahead and pick up the kit from the bottom and come in from the side to empty the contents of the kit onto my field to not contaminate it. Next, I would go ahead and open my sterile saline to pour into my kit. When you pour sterile solution, you want to make sure the label is in the palm of your hand. This is a brand new bottle. If it wasn't, I would lip the bottle. And you want to place the cap so the inside is facing up, and just pouring about 4 to 6 inches above it. And now I'm going to go ahead and put my sterile gloves on. I'm just maneuvering so that my back is never to my field. So I go ahead, open them. And once again, only touching the 1-inch outer border of this. And to put on my first glove, I would just be sure to only touch the inside portion of this because it will not be sterile. And keeping my hand above waist level. And then to glove my other hand, I would go grab the inner portion of the cup to not contaminate it. Okay, so now I am going to go ahead and carefully reach from the side of the field to just kind of arrange my supply so I have everything I need. And I'm just being careful to make sure everything stays within my 1-inch border. I go ahead and place this in the sterile saline for packing. And then I would carefully open my Q-tips to clean the wound. I would start by cleaning one of the outer edges, and in a twirling motion from top of the wound to bottom, I would go ahead and clean one side. And then down the center. And then the other side. Now that it's clean, I will go ahead and pack the wound. I'm going to, once I put my hands in this, it will be my clean hand. It's no longer sterile. So I would just start by wringing it out, just being careful to not get any of the solution on my field because then it would be wet and contaminated. You can go ahead and pick up my the sterile forceps, they will go inside to pack the wound, and you just want to be careful to not put your clean hand inside the wound. When you pack the wound, you want to make sure it's packed just to the top, not over the edge. And I will now go ahead and place 2 gauze pads. Over, and then the ABD pad on top. And I need to now tape my wound. So let's grab it. Now that the wound is covered, it's now considered a clean procedure, so I can go ahead and use both hands. I would just tape the wound in a window pane fashion so that all 4 edges are held down. And on this last piece of tape, I would just go ahead and initial it with the date and time that I changed this dressing, because you don't want to do it when it's on your patient and right on your patient. Probably hurt. And now that his wound is all taped, I would go ahead and remove my glove. Oh, before I do that, I would remove my garbage here and put it in the trash can. And then I would remove my gloves and perform hand hygiene and cover my patient up. I would put the side rail up so he's nice and safe. Raise the head of the bed for him and move the bed to the lowest position, making sure that his call light is in reach. And thank you very much.